Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. The total number of cases remains at 300. This morning, no individuals are hospitalized and there is no one in ICU. As of this morning, 286 individuals are listed as recovered and there are 7 active cases. Yesterday, an additional 735 lab tests were performed, taking our total to 51,460. Earlier today, we announced a number of changes that are proposed for our Phase 3 as we restore services in Manitoba. We continue to look at a number of key factors when making these recommendations, how this virus is transmitted, our current positivity rates, healthcare capacity in the system. We've looked at protecting those who are susceptible to outbreaks and to severe outcomes. And so based on that data and our current case numbers, our testing capacity, we felt it again safe to put forward this proposal for Phase 3 to continue our opening of our economy. We'll obviously continue to review those numbers as time goes on and do things cautiously and continue to follow our progress. So we remind Manitobans that we've done well. Our numbers have been favorable, but COVID-19 is not going away anytime soon, and we need to continue to deal with this virus in one shape or another for the foreseeable future. And so Manitobans are learning to live with this virus, to be aware that we can never be in a zero-risk situation, that we have to adjust the way we live to accepting some level of risk for this, and that will require Manitobans to make informed choices about the level of risk they're willing to take. Again, as we loosen our restrictions, these are just that, a loosening of restrictions. They're not a directive to any business or any individual to do anything. So we may see some businesses not opening up immediately. We may see some businesses not moving to the full allowable capacity, and that's fine. And individual Manitobans will have to decide on the risk they're willing to take as they increase the ability to get out and about in Manitoba and utilize services. This is not unusual. We take risks in our lives every day, and so we'll need to continue to make informed decisions about that. So Manitobans are well aware of things we can do to reduce our risk of this, and that includes frequent hand hygiene, maintaining physical distancing from others outside of our house whenever possible, covering our coughs and sneezes in times when we cannot maintain that physical distancing, then certainly the option to wear a non-medical mask is there. And vital to our success as Manitobans, we need to understand that we can't be going to work or going out in public or going to school when we have symptoms of illness. We know that this virus is spread predominantly through close, prolonged contact with those showing symptoms of illness. And so people staying home when they're ill is vital to our success. Certainly Manitobans showing symptoms of COVID-19, fever, cough, runny nose, sore throat, aches, headache, loss of smell, loss of taste can certainly present for testing. We have a lot of testing capacity, so certainly we want to identify cases early, isolate them, and do our contact tracing, which has been so successful to this point. So I encourage Manitobans with symptoms to get tested. Those who are at high risk of severe outcomes, those over age 65, those with underlying medical conditions, especially cardiac or respiratory illness, those with immune compromise have to take extra caution. Do whatever you can to limit the chances of being exposed to this virus, and that means avoiding larger groups, avoiding prolonged close contact with others or any crowded locations. Frequent hand hygiene is vital. And so Manitobans can continue to access credible information regarding COVID-19, manitoba.ca/COVID-19. And just a note is that we'll not be issuing media bulletins on the weekends any longer. Updated case numbers will be provided at Manitoba Gov on Twitter. And weekend data will be rolled up on our Monday bulletin. So thanks for this, and I'll open up to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this afternoon from CTV Winnipeg, Michelle.
Hi, Dr. Roussin. I'm wondering about the changes in the self-isolation returning from Western Canadian provinces. You've talked before about not reintroducing the virus into Manitoba. So what about the Western provinces now kind of drove that decision to include that in phase 3?
So it still is a big risk to Manitobans is the importation of the virus. And so we, like any of these restrictions, we want them in place for the least amount of time that's necessary and at the least restrictive level that's necessary. And so looking at the epidemiology in the Western provinces, we've seen favorable trends in that area. Same thing with Northwestern Ontario. And so we find that, as soon as reasonable, we're going to lift those requirements. There's lots of benefits, again, to lifting these restrictions once we know that it's at a safe level. Again, nothing we do is going to ever be a zero risk. And so we have to accept some levels of risks with the benefits of increasing or opening up our borders. So we're going to keep our eyes on those numbers quite closely. This is a consultative document out. This is the draft document, and so we're not looking to have it in effect anytime prior to June 21st. So there's time to hear feedback, and there's time to further watch those numbers.
So just in follow-up to your answer, so when you're saying being in those areas for as little time as possible, so like family trips to see loved ones in other provinces, are those okay, or how do people make a decision on how long they should be staying?
I'm sorry, I didn't catch the last part there. When people travel to another province, how long should they stay there?
Yeah, how do they decide how long is okay?
Yeah, and so I think that it's an informed decision. I think if we've signaled that we're lifting the restrictions on the 14-day isolation period. Again, that's a loosening of a restriction. It's not directing any Manitobans or any Western Canadian to travel. It's just loosening those restrictions so people can make their own informed decision about the importance of the trip. And even when they're traveling, all those very basic precautions that we keep talking about, staying home when you're ill, frequent hand hygiene, physical distancing should just be practiced as well to reduce our risk no matter where we are.
From City News, Jonas.
Good afternoon, Dr. Roussin. Jonas Gilbart, City News. Looking for maybe more of, I guess it would be an anecdotal comment from you on just our progress through phase 2, what you were expecting, and the results we've seen seem pretty remarkable.
Yeah, and so phase 2, we're still a little bit early to have a conclusive judgment on phase 2, but certainly our positive test rate has been quite low. If we look at for the last 5 days, it's been 0, and so we see low case numbers, we see high capacity in our healthcare system that continues, and we've seen low test positivity rates, and so from this. We felt it's safe to put forward our proposal for phase 3. And again, we're still some time before the implementation of that, where we can continue to watch our numbers and also can receive some feedback from various Manitobans on our proposal.
Just kind of following up on the interprovincial travel in Northwestern Ontario, Premier Pallister had mentioned there may be a dividing line, maybe just somewhere west of Thunder Bay, whether it be before Dryden or somewhere like that. Is there anything in mind that you guys have decided on that?
No, we don't have anything decided specifically right now. We know that the epidemiology in northwestern Ontario looks favorable, so we want to include that. What the specific geographical line will be in the actual public health order, we haven't decided as of yet.
From the Winnipeg Free Press, Dylan.
Hi, Dr. Roussin. As we move to phase 3, I'm wondering what is the philosophy around testing? I know that Manitoba has allowed asymptomatic people to get tested. Is that being ramped up, or is the philosophy still more wait and see around who has symptoms?
Right, so certainly the value of testing symptomatic individuals is much higher than testing asymptomatic people. And so certainly the big message is we want Manitobans who are showing symptoms of illness to stay home, not to go to work, not to go out shopping, not to go to school, and then we're encouraging them to get tested if they have symptoms. As far as asymptomatic testing goes, we're doing some of that targeting those groups that might be at higher risk of getting the virus, say in those who are leaving the province regularly. And so we're certainly not turning away people who show up for testing, but we're not encouraging just the average Manitoban to come if they're not having symptoms.
And the province is allowing asymptomatic truckers to get tested. So why are there no truck stop testing sites? And are we doing anything proactive to actually do random testing of target population?
So what we want to do for the truckers, we engage with the Trucking Association on this, and we're great partners with us. And so the decision was not to set up specialized testing points for the truckers, just to lift our the guidance for testing to allow asymptomatic truckers to present for testing, and so that was the what we had decided. We're still doing the sentinel surveillance. We're offering testing for at various sites that people presenting for alternate reasons are offered that testing. So we're still having ways to search for and pick up community transmission.
From Global, Marnie.
Good afternoon, Dr. Roussin. Marnie Blunt from Global News. When it comes to lifting the restrictions on both on travel and just rolling out the reopening plan as well, what would you need to see happen to the numbers in both in our province and in maybe the other Western provinces as well that would cause us to either slow down or halt our reopening plan, or even maybe put that 14-day isolation rule back into place?
Mm-hmm. Yeah, so for in Manitoba, the numbers that we're focusing on is our positive test rate. And as well as various measures of health system capacity and the demand on the health system capacity. We're also looking at not just the overall number of cases, but cases that we can't link to travel or to known cases. So there isn't going to be just one indicator that's going to make us decide one way or another. It's going to be trends. It's going to be multiple indicators that might make us rethink things. And so we follow those numbers quite closely. In other provinces, it's much the same. It's really looking for evidence of widespread community-based transmission. If we see widespread community-based transmission in a province, then that's going to make us want to consider, the 14-day isolation when people come from that province.
Thank you. And just as a follow-up, you said it's kind of, in terms of how long people should travel and if they should travel, it's kind of up to their own discretion. But people to avoid non-essential travel if possible. A lot of people will probably be wanting to visit family in other provinces or go camping. Would you still advise Manitobans to avoid non-essential travel, even though as of June 21st they will be able to?
Yeah. So again, this is a transition period. So we need to learn how to live with this virus, because we're going to be living with this virus, whether we like it or not, for the foreseeable future. And so certainly when we had a transmission of the virus occurring in Manitoba, when we're early on in the first wave, we put on a lot of restrictions, including that on travel or advice to limit that. As we start loosening things up, then again, it's going to be that transition that people will need to decide on their own what level of risk they can take. There's a lot of things in place to reduce those risks that we mention at all times. And then, of course, those that are at increased risk of severe outcome should be even more cautious with everything they do, including travel.
From the Brandon Sun, Michelle.
Yes, hello, Dr. Roussin. Michelle Turner from the Brandon Sun. I'm just wondering, I know that a variety of agencies have together deployed 4 of these Gen Expert machines to the north. Any plans for southwestern Manitoba?
So the Gene Expert machine is a rapid test, but it's a low volume test. So what it's utilized for is when there's a significant benefit to having a rapid test result. And so most places and most individuals, if they're symptomatic, we can test them. They can self-isolate pending results. In places where there might be a remote factor, where self-isolation within the community is quite difficult, there might be significant benefit to getting a test result back right then, and so we can work out ways to isolate that individual. And so right now, the focus for these type of testing devices are in response to, say, outbreaks in remote isolated communities is the biggest benefit. But as there's more and more resources available. As more of these testing kits become available, we may look at other geographic areas, but it's key to note that these are rapid but low volume. We can't do a lot of tests in this manner, so we reserve it for when it really matters.
All right, thank you.
From CJOB, Diana.
Good afternoon, Dr. Roussin, Diana from 680 CJOB. With regard to the proposed loosening of restrictions on self-isolation for travelers coming from the western provinces or northwestern Ontario, would that be retroactive? Say if someone came back from Alberta on June 18th and they were self-isolating for those first couple of days as mandated to, they had no symptoms, would they be able to stop self-isolating on June 21st?
Yeah, it's a good question, and I think we haven't written the order yet. This is still a consultative document, and we're still looking at the numbers. But I think if things stand the way they do now, I do think it would work that way, that it wouldn't make a lot of sense that somebody coming on the 21st would no longer have to self-isolate a single day, but somebody who's already been here self-isolating 7 days would still have to do 7 more days. So it would likely look that way.
Okay. And then as a follow-up, with respect to larger gatherings like sporting events, that's still listed in future phases, of course, certainly no sooner than September. Your counterpart in Saskatchewan has said that sort of thing in that province they don't expect it to happen until next spring, so kind of June of 2021. Are we still aiming for the fall, looking at the fall for consideration for larger gatherings like sporting events?
Well, we're still looking at it. I think with all of our orders, all of our measures, we've always said everything is on the table. So we're still looking at it. I think the real challenge with looking at this fall is that we're then getting right back into respiratory virus season, plus or minus COVID during that time. So it might be challenging to make big changes in that type of environment. But we're still looking at it and still haven't ruled it out.
Thank you.
From the Winnipeg Sun, Scott.
Hello, Scott Billick here from Winnipeg Sun. Question for Dr. Roussin. Going to one of the pro athletes provision in the new plan, will that extend to, let's say, the families of both players and like club officials?
Yeah, so as it reads right now, it's just related to the actual athletes and officials and other employees of the organization, and so that would be the first step that we would be taking.
And then just a question, and maybe it was covered just a couple questions ago, but In terms of the 14-day self-isolation for athletes coming here, I mean, we've seen a lot of travel-related cases, and for a while there, a lot of those seem to be on flights and stuff like that. Does this 14-day isolation mean anything coming back? When there's still between getting back to the province or coming into the province, there still is likely a flight that takes place and stuff like that. Like, well, I guess, what is the reason for that 14 days beforehand when the actual travel needs to happen, before that and after that initial 14 days you're talking about in the plan?
Yeah, so it's just a level of risk. And so certainly somebody who was not self-isolating at all within their jurisdiction and came, then their risk of being exposed and if there's community-based transmission is higher. If they're self-isolating and the only time is a flight and that travel, then certainly the risk is lower. Like we said, we're never going to be in a zero risk situation, so we need to find ways that we can live with this virus and still have some functioning in the things that that benefit us. So it's a risk reduction, but none of these steps would take our risk to zero.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin. It's Mohammed from Radio Canada. I have a question regarding the travel restrictions. Have you spoken about this with your Western counterparts? We know that Alberta and BC still ask people not to go to their provinces. And did you talk to them beforehand, and what was their input?
So we meet regularly at the Special Advisory Council committee at the Council of Chief Medical Officers of Health. So we meet 2 to 3 times a week with all the chief medical officers. So we've discussed the approach in Canada. So Manitoba in the western provinces is the only province that has this type of order in place requiring the 14-day isolation. And so again, this is a loosening of restrictions. It's not a directive for anyone to travel anywhere. We've never had a restriction on Manitobans leaving Manitoba to another province or a restriction of somebody coming back in. So it just was that they were required to self-isolate for 14 days.
Thank you very much, and I have no follow-up today.
From CBC Manitoba, Aidan.
Hi, Aidan from CBC News. My question is regarding the rapid test kits to be used in the north. I know you've already touched on this regarding geographical areas, but is there any consideration right now being given to making these tests available to other groups that might be at high risk, such as like truck drivers, for example, or people who live in congregate settings?
Yeah, so I think that as our testing strategy evolves, there's always been a component of the rapid tests with that. So we continually review things. We don't have anything specific in the works. We just have these test kits right now. But as time goes on, we may be able to acquire more and put it to use in the program. So again, it's what they're useful for is that rapid testing, but they're not that useful for high volume testing. So it would just be a component of our testing strategy.
Thank you. And my follow-up is, we heard from the Premier this morning, he referenced the concept of zones, such as amber zones, red zones, in terms of categorizing the level of risk in the province, when to move forward or roll back with restrictions. So can you share with us how you're defining those zones and the specifics of what each one means?
Yeah, so we don't have any such zones at this point. I think it's an important thing to consider should we see the need for that. So we follow the epidemiology in all of our health regions and break that down. And so if we saw that there was a certain region that was seeing community-based transmission as opposed to other regions, then that might make us take some targeted action in that area, but we're not at that point yet. We have very low numbers, so we don't really have any such red zones at this point.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, I know with interest the changes, the proposed changes here to professional sports athletes and film production people. But they continue to be subject, if they arrive from out of country, from the United States or Europe, they're still subject to the federal quarantine requirements, correct? They would still have to quarantine for 14 days if they arrive from the U.S. or Europe?
That's correct, yes. The Order in Council under the Quarantine Act is still in place at this time, and that's separate from our provincial public health order, so that is still in place right now.
Okay, and you mentioned earlier that no decision has been made yet as to how far into northwestern Ontario the exemption will be for the 14-day self-isolation. Am I reading the epidemiology right in Ontario? This seems to be mainly a Quebec and very southern Ontario problem. Most of the north, not just the northwest, seems to be relatively free.
That's right. Yeah. So it's again when we're going to take that in consideration when we make these orders. Things that we want to consider is the likelihood of people traveling to those higher risk areas and then back to say Northwest Ontario. So we're still going to have a large buffer zone in there. We haven't decided on the exact geographic location as of yet.
From the Flin Flon Reminder, Cassidy.
Good afternoon, Cassidy from the Flin Flon Reminder. In the proposed plan, other provinces would be allowed to travel directly to campgrounds, much like southern Manitoba residents. What is the plan on communicating the specific rules to those out-of-province travelers?
Yeah, I think that it's just we would be posting our public health orders as per usual, and if there's any, it wouldn't be up to us to necessarily be, marketing that. We would do our typical social media presence on a change of our orders and guides. So I would leave any need for marketing to others.
And as a follow-up, no changes to the northern travel recommendation or just general travel restrictions in Phase 3. Is that something that could change in between phases, or is it something that you'd be looking to change at the changeover between phases, like at a phase point?
Right. Yeah. So there is a bit of a loosening of it in the proposed Phase 3, and it's like what you mentioned that those provinces that we don't say have that 14-day isolation, they would be able to travel up north based on those limitations. But yeah, this doesn't have to be tied to a phase. We could look at this when we see fit that to further loosen or to remove those travel restrictions to the north.
Thank you. We have a few minutes left this afternoon, so if the reporters on the line have any further questions, please ask them now.
Dr. Roussin, Diana from 680 CJOB. I meant to ask Lynette Sardisa, but she is not in today. Are you able to say where we are on sort of surgical capacity right now? Are we back to normal?
Yeah, so certainly that has improved. Certainly not back at 100% for a number of reasons. One of which is just the need for physical distancing and the space that's required. So I don't have the details on that, but it's certainly been increased, but not certainly not at 100% at this point.
Dr. Roussin, why are the Gen Expert machines that are being rolled out limited to people who have symptoms who can't isolate as opposed to everyone else? Is there a difference in the effectiveness or the cost of the test versus the normal one?
That has more to do with the, like I was saying, that it's a rapid test, but it's not a high volume test. We wouldn't be able to run, hundreds and hundreds of these in a day for that. So we want to utilize that when it's most needed, when having a diagnosis right now would make a bigger difference. And so we still have the typical testing done through the CADM lab, which is the high volume testing. So that's the reason behind that.
Dr. Roussin, Diana from CJOB again. Gyms are not mentioned among the businesses able to increase their capacity limits in Phase 3. Will they be staying at that reduced 50% maximum capacity for the time being? And when might we see those limits kind of relaxed?
Yeah, so if the things that were in Phase 2 aren't mentioned in Phase 3, then they stand, and the gyms is that, so it still maintain that 50% capacity. And so we felt that, even in Phase 2 in our original thinking, we were going to include the gyms in Phase 3. But as we saw our numbers, we included them in Phase 2. So we didn't really see the requirement right now to increase that capacity. There's still the higher risk issues going on in the gym, and we felt that at 50% capacity we've quite reduced that risk quite a bit. And so I think that from what we see, many of the operators are complying with this and doing a great job at minimizing the risk, and so at this point we haven't increased that capacity, but like anything else, we continue to look at that. So certainly in the next phase we would be addressing that.
And just as far as the self-isolation restrictions relaxing, go for it, sorry.
Sorry, describe those from this one here then. Is the message really for seniors changed then? Like, do they, are they having to now, learn to live with the virus as well? And does that mean they should, think about maybe going out now, or is the message still that stay home and because they are part of that I guess that higher risk age group?
Mm-hmm. Yeah, and this is a challenging situation, and so we do have to live with this virus, and it's not going to be just next month or just more a month or two. It's going to be for quite some time. Going to be likely a year or more that we need to learn how to live with this virus. So we definitely want to articulate to those that are increased risk of severe outcomes that they need to take extra caution. What that looks like for them is going to be largely an informed choice by them. So, hand hygiene, avoiding large crowded areas, large groups, crowded spaces, and even in our guidance document to senior centers, we're recommending lower maximum group sizes in there just to address some of that. But a lot of this is going to be up to Manitobans to make informed decisions. And we're pretty confident in that because it's been Manitobans' actions that have put us in this place to be reopening like this.
Dr. Roussin, Diana from CJOB again. With regards to the self-isolation requirements changing for Western Canada, Atlantic Canada also has pretty positive epidemiology like Manitoba. Why can't travelers from the Maritimes come to Manitoba without self-isolating? Is it a question of kind of distance and the fact that they would have to pass through likely Toronto airport?
Yeah, there is some of that, and so the Western Canada is contiguous, so it was fairly easier to make that decision. Certainly, the Maritimes have favorable epidemiology, and we've certainly looked at the idea of excluding those provinces as well. But like you said, they may be required to travel through provinces that have more community-based transmission. They're not contiguous with us. So we felt that we would do the Western Canada, Northwestern Ontario at this point, and to continue to look at further measures moving forward. Just like the northern travel restrictions, these travel order, we don't necessarily have to tie to a phased approach. Once we see things are safe, we can move on that.
Thank you.
Dr. Roussin, it's Jonas for City News. Just a quick one for this summer and folks with weddings. We could see the outside limits went up to 100. I guess your advice to folks that may be wanting to pursue an outdoor wedding this summer, or what you would tell them?
Yeah, I think it's right back to that message that Manitobans are going to need to make those informed decisions. And so we know that outside, much less risk of transmission, but larger groups, the larger a group, the more likely someone there has symptoms. The larger the group, more likely if somebody was infected, they would be able to transmit that to others. And in the larger the group, the more difficult it is to contact trace everyone who may have been exposed. So those are the risks involved in it. But we feel that given our numbers right now, those group sizes, those group size maximums still represent a relatively lower risk activity. But we're going to need Manitobans to decide the level of risk they're willing to take. And even within that, those who are at increased risk of severe outcomes, we're going to need to decide whether those type of events are safe for them to attend.
Hi, Dr. Roussin, Aiden from CBC News. I'm wondering if you have any advice for teens who are graduating or their families trying to plan graduation ceremonies outdoors, maybe, for people who are finishing high school or university this time of year. Do you have any advice for people trying to plan those events and where they'd like to see them?
Yeah, so I think that they should read the orders, the proposed orders or guidelines quite carefully, because there's a lot of guidance in there. For that, and the maximum group size outside is 100. But if you read the guidance there, that if groups can be cohorted, that there's no intermingling between groups, then there could be a maximum of 3 of those 100 cohorts. And so I think there's opportunity for people to plan. Again, these are proposed changes, right? These aren't going to be in effect on June 21, and they don't necessarily have to look the way they do now when June 21 comes. So that's a cautionary note. But I think there's some opportunities with our low numbers and with the nice weather and being outside that some of these events can be planned to a fuller degree than what was expected.
Cassie from the Reminder here. I was just wondering if the Gen Expert machines being put into place, is that a step to allowing northern travel relatively unrestricted again?
No, I don't think that really plays a role into that. The northern travel restriction is going to be based more just on prolonged reduced transmission of the virus here, and about protecting some of the the most those communities that are susceptible to severe outbreaks, and so. It's part of our overall testing capacity, so it's part of our overall program, which does play a role, but it wasn't there for that specific reason.
Thank you. And this concludes our media briefing.
Thanks.